Cheryl Chafos adored her son Zachary.
He was diagnosed with epilepsy and also intellectual disability, but was very happy, loved his family, loved Disney, Pixar, and just enjoyed life to the fullest.
Zachary was autistic and nonverbal, and he sometimes struggled with aggression. When he hit a breaking point in late 2020, his parents took him to the ER.
When you try to get to a psychiatric bed, you have to start off in the ER. He was in the ER for 28 days waiting on a bed.
Chafos says her son's condition rapidly declined as he waited for that psych bed, away from his family, stuck in a windowless ER room, and only allowed one visitor per day.
He also was very violent with the staff members, where they had to strap him physically to the bed for hours and sedate him. And they had no choice. They had to do that to him. It was a terrible cycle that he was in.
I can't imagine. I mean, 28 days of
28 days.
Essentially in isolation.
In isolation.
Chafos says she was told that if she pulled her son out of the ER, he would lose his spot on the wait list.
In many places around the country, there are available psychiatric beds, but there aren't enough nurses or technicians or psychiatrists to be able to provide the needed care.
162 million Americans, almost half the country, live in an area with a mental health workforce shortage.
This is not a new issue. It's just gotten worse, and the pandemic has really accelerated our challenges.
When COVID struck, beds were already at historic lows, and even more were lost as some psychiatric units were converted to impromptu COVID wards, or they had to reduce capacity to keep patients isolated.
A lot of the people delivering care have been under a lot of stress themselves. We have had a surge of people who have chosen to retire earlier than otherwise might have happened.
Now, policymakers scrambling to restore beds and staffing levels. The city of Boston is planning to launch a program to pay college tuition for 200 students entering the behavioral health field.
In terms of need for behavioral health services, they're dire. In Boston, for every 10 behavioral health clinicians who are coming into the field, there are actually 13 leaving the field.
In Washington, a bipartisan group of senators is pushing legislation to repay mental health professionals student loans, while the governor of New York is demanding hospitals bring more pre-pandemic beds back online. And back in Maryland, Cheryl Chafos is now pushing for a state law to limit ER wait times to 48 hours before a patient gets a psych bed.
The ER staff, doctors, nurses, they are there to treat broken bones and wounds. They are not equipped to handle psychiatric patients.
Zachary went to the ER again in 2021 for 7 weeks. Just 10 days after getting a psych bed, he died after having a seizure.
It's important that no other family has to live through this nightmare, and it was a nightmare for us.
And we reached out to both hospitals that treated Zach, and neither would discuss this case, they say, because of privacy laws. Dr. Tressman says there needs to be more investment across the industry, both in training and in facilities. Back to you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.